But we're going to talk about really thinking about community engagement, and we always talk about trust and what that looks like in our spaces. So not just, hey, what is the background on clinical trials and things of that nature and why people are distrusting of the healthcare space, but just in general, how do we go about building trust with individuals, and how do we do that in a way that's mutually beneficial for the people that we're engaging with and everybody else that's a part of that partnership. So with that, we're gonna think through building trust through transparency, empowering patient voices, and also overcoming barriers to trust. Okay? So prior to that, I'm gonna let each of you introduce yourselves. So I'll let you go first.
Perfect, thank you. Can everyone hear me okay? Okay, great. Yeah, hi, my name is Siwaar. I'm a clinical research coordinator on the Rare Genomes Project, which is a rare disease study based at the Broad Institute. My background is in public health and community organizing, so I've been thinking about trust long before I entered the genetic space, so I'm really excited to talk to you all today about some of our work.
Hi everyone, my name is Claudia Gonzaga-Jauregui. I'm a human geneticist. So I do research on rare diseases. I've been doing that for the last 15 years or so. After 12 years training and getting my PhD and working in the biotechnology industry and biopharmaceutical, I went back to Mexico in 2021 to do research to facilitate access to genomic sequencing in Mexico and Latin America. And in 2020, we started also a collaborative for rare and low prevalence diseases in Latin America and the Caribbean to address issues of access to diagnostics, testing, and therapies.
Hello, I'm Cecile Jones. I am the community healthcare ambassador with All in Rare. In the Alabama area, so I'm here to talk about community engagement and what that looks like.
Okay, so we're gonna hop right in, and we're gonna start with building trust through transparency. And I'm gonna start with you, Siwaar. What specific steps can organizations take to foster transparency in their communication and decision-making processes? And then we'll move into how can these specific actions help build trust within the rare disease community?
Right, that's a great question and very big question, I would say as well. But just wanted to establish that communication is really key, just because as everyone in the room knows, either personally or professionally, the diagnostic odyssey can be really long and winding, and so it can take years or a lifetime sometimes to find that answer. Or as we just heard, it can take decades and a lot of mistrust and a lot of sometimes, discriminatory experiences that unfortunately lead to having it take longer than it should be. And so at the Rare Genomes Project, we try to implement communication in our daily operations. And so as one of the clinical research coordinators, we conduct consent calls at the start of the person's or the family's participation with us to really establish what they can expect, to also make sure that they know that, we're here for them at every step of the way. And so we're constantly answering the emails and the phones and trying to kind of reassure families, especially because we're uniquely hybrid. So while we're based in Massachusetts, we work with families across the US and US territories as well. And so that includes, establishing trust at that first consent call, but remaining and kind of holding true to our word of always answering and always being there. We've also learned that sometimes it can take in-person events, or sometimes it can take us going to the community and not expecting the community to come to us. And so I think that's a really big lesson too in community engagement, that when you're virtual, sometimes you have to step out of that Zoom screen or that laptop screen and really try to kind of meet communities where they are. So I think that was a really big lesson for us as well.
I love that, Sue. I love a lot, but I really love this idea that a lot of us, how many of you work in office spaces? Okay, yes. So we talk about community engagement, but at some point, we have to get out of those spaces, even though that may be very difficult. I always tell people I'm an introvert, and it's very hard for me sometimes. However, I think that if we are trying to build this idea of transparency and trust, we do have to step outside of the walls of where we are, especially in academia, and put down some of those doctors and titles and all of that to engage with the people that we're trying to engage with to build authentic relationships. So with that, I'm gonna push it over, and I know Cecile's gonna give me a look. Cecile, I'm gonna pass it to you because I know you've done a lot of actual like grassroots community engagement with the All in Rare project. So can you tell us a little bit about that?
So basically, you know, it's very important to engage our community. People who are dealing with rare diseases or any type of sickness for that sort, they don't want to hear these facts. Of course, they know what they already have. They already know what they're dealing with. So they don't want anybody coming into their personal space telling them, well, you got this, and you need to take this, and you need to take that in order for you to get to this place. They don't want that. They want someone that's going to be sincere. They want someone that's going to hear them. They need to know that you're on their side. And people know that. They can feel your energy. They can feel if you're sincere or not. If you're not sincere, it's just whatever you're saying to them is going to go in one ear and out the other. So when people know that you really care about them, when they know that you really are concerned about their health, they're going to be more be more willing to share. They're going to be more willing to listen. They're going to be more willing to take your advice on, take this medicine, do this, come here, do that. And of course, you know, when you're dealing with people who have these sicknesses, you know, there will be some type of barriers. You know, some of them may not have reliable transportation. Some of them may not have, you know, money for their medicine. But, you know, what I do is, you know, we have local resources in the state of Alabama that can help them. And what I do is try to connect them to those resources so that they can be able to get what they need. But it's most important. My pastor always said, people do not care. People do not know how much you care until what you've done. So you may be talking to them about, whatever that you're talking to them about, but what you do, that's what they're going to remember. They're going to remember what you did more so more so than what you said.
Yes, thinking through just times where even like little newsletters, personalization, sending people happy birthdays, all of those things matter in the work that we do. And I know that's some of the things that we're trying to do in All in Rare, and it's very difficult, but we also want people to think, hey, this is a great relationship. We're taking our efforts and trying to build that, as well as they're giving their time, which is always precious. I love thinking about, Cecile, you mentioned, like they know, and their voices are very important. So we're gonna move into how do we really build out those patient voices. And oftentimes they don't necessarily need to be built out. They already have voices. So how do we go about doing that? So I'm gonna ask this to Claudia, and it's another loaded question, Siwaar. Can you share successful examples of how organizations have effectively engaged patients and their families as active partners in research and treatment decisions, and really thinking about anything that we do in the rare disease space?
Yes, thank you. So in Mexico, when I went back and we started the research on rare diseases, so it was very important to have the patient voices and have that connection with the patient organizations. So back in 2021, the Mexican government said they were going to open the national registry. It was open for 2 months, and then they shut it down because it was in the middle of the pandemic and they didn't want to look bad. So we were asked to do something to help, and in 2022 we started the registry for rare diseases in Mexico. And to get to that, we engaged with the patient organizations. We had focus groups with them to review the questions of the questionnaire and to get feedback, what was understandable in the questionnaire, what questions to include or maybe remove and that. So we've tried to engage with them throughout the process, and then we finally released it on Rare Disease Day on February 2022. And then same thing for the collaborative in Latin America. We've had a lot of patient organizations be part of the working groups. A lot of them are very active in the education and awareness group, precisely because they want to be heard, they want their stories to be known. So we have some conversatories that we organize every 2 months or so on different conditions to also hear about the patient experience, not just sort of the technical terms about the diseases and that, but also how they live with these conditions.
Yes, I love the idea of the resources that you have and making sure that you're just not doing them back again in those office spaces, right? In our office spaces, creating this educational material, but making time to actually go out to the spaces in what we call in the research room, piloting that work with people to say, hey, you know, this is the population I'm working with. How about you look at that in advance and let me know if the language is too difficult. I know in All in Rare for sure, before we launched our website, we talked to our community advisory board. We also talked to our steering committee to find out like what I may think that this makes sense, but to a person in the community, they may not think that that makes sense. And how do we not get offended by some of that, but we change that language based off of what we're receiving from individuals? I'm gonna move to you, Siwaar. So thinking about everything that Claudia just said, are there times where you feel like you all have learned lessons about these experiences and how you could potentially do those better in the future?
Yeah, that's a very important question. I would say kind of pivoting back to this idea of collaboration, it's important to know what your organization can do, but also maybe what you can't do and when you need to collaborate with other organizations and build kind of this large collaborative to make sure that the work gets done well. And so one idea that comes to mind is when I first entered the role, I mentioned I came from public health. And so I used to work with Middle Eastern and North African patient populations in America. And so when I started in genetics, I realized quite quickly that they're very underrepresented, kind of the rare population within the field, where less than 0.01% of participants in genetic studies identify as Middle Eastern North African. And so I worked with the Broad Institute and Rare Genomes Project to launch this awareness campaign that we called Project MENA Pedigree. MENA is Middle Eastern North African. Pedigree is a very long acronym. It's Progressing Equity, Diversity, and Inclusion in Genetic Research, Education, and Empowerment. Yeah, I do know it. It's just long. But quite quickly, we realized that, you know, we can't expect community members across the country to kind of join our Zoom calls when they have no idea who we are, when maybe there's a language difference, even if there is language compatibility, maybe genetic words are scary or unfamiliar. And so we partnered with community organizations and genetic counselors and geneticists within the community across the country to launch this campaign. And so we learned early on that sometimes you need to know what you're capable of, but also collaborate with others outside your organization for the best of the initiative in the community. And so we did 2 in-person events so far. We have 1 more coming up in October, and it's been really great. I think it's been really empowering for the community and taught us that we need to collaborate, and it's not a game of, you know, can we do it all? It's we have to kind of share that responsibility with other organizations as well.
I was tempted. I wanted to say something so bad, and I'm waiting for you to love it, Siwaar, because I do think that we are so possessive of our work sometimes, especially in the research space, where we feel like everything that we gather is ours, right? But at the same time, understanding that we aren't the experts of everything. And I always tell people that community members, as we all know, are experts in their communities. So oftentimes we have all of these letters and we have this education, but when we're stepping in a new space, they're always the experts of what they're doing and what they need. So really taking a step back and saying, okay, so we have you here. Thank you for partnering with us. What are some local organizations that you all actively work with that can help us with the work that we're doing? So I think that's so important that you mentioned that. And to our last really point, I also think that it helps overcome some of those trust barriers. And we'll get into that. And Cecile, I'm back to you. So what are some common barriers that prevent trust from being established between organizations in general and the rare disease community?
Well, most of them pretty much are really people coming in wanting to get the information to use it for their reports or to use it for their data. You know, when people are struggling or are having these health issues, they don't need another person to come in to collect data. They don't need another test for someone to run on them. They don't need another second opinion when they've already on their 4th and 5th, opinion. They don't need that. And what happens is that when different people come in, they begin to lose trust, they begin to lose hope, they begin to no longer desire to even go further with the treatment. They begin to second guess if they want to even keep living. We did an event in Alabama, and I had a therapist, a mental health therapist, come and talk about the importance of going through your situation when you having health issues. And she talked about the importance of talking about it. She talked about the importance of speaking with someone and allowing your emotions to feel your emotions. So it's important to just be like really sincere. It's important to be present in that moment, like really hear them, because if they feel like they're not being heard, they're not gonna open up. And the test or the data that you want, they're not gonna give it to you, because they already sense within themselves that that's all you're here for. So they need to know that you really, really do care. And when they see that you don't, they're gonna shut down. I hope that answered your question.
Yeah, it did. I call that helicopter research, where we're at our own, and this is not just academics, but we're in our own facilities, right? We have this grant, and I don't want to take away the idea that many of us work in very stressful environments where we have a grant, there's a timeline, we must do this by a certain timeline. However, this idea that we have this information, if we haven't already reached out to a partner, we created this grant in a silo, right? And then we get the funds and we need to work with somebody immediately. And we craft up all of these different surveys and metrics that we need. And then we get in our helicopter, we fly over, because it has to be fast, right? So we gotta get a helicopter. We can't walk, we can't drive. We gotta get this helicopter and get over there into the community, not build these relationships, but ask them, hey, I need you all to complete these surveys for me. Have them completed, even though they're already survey fatigued, right? Get this information from them, and then get back in our helicopter and go back to our workspaces and never communicate with them again. Yeah, so imagine that. That's like thinking about gaslighting in relationships nowadays. I'm not really into social media like that, but what's the word where people ghost you, right? Yeah. It's like ghosting community members. Like, who wants to do that? Like, you get all of this information, you don't even follow up to say, hey, this is what happened with the information you gave me. So imagine if that happened in a personal relationship. It's devastating. So we don't want to do that to people that we work with and we want to build authentic relationships
And
with.
it's fine if you want the information, but just sending someone out there who they trust to get it, don't you go out there and get it. If that's what you really need, it's just like a child, they're coming up to you like, hey, mama. No, they don't even say, hey, they just say, I need money, Like, no, just, send somebody else out there to get it. Don't you get it.
My phone's probably ringing from one of my kids right now about that exact same thing. So thank you. And and Siwaar mentioned that, like this idea that sometimes it can't be you. Sometimes you can't be the face. Sometimes you need to partner with someone else. I'm gonna let Claudia close this question out by asking, so Cecile talked about all of these barriers to trust. How can these barriers be addressed to create these more collaborative networks amongst community members and community partners?
Yeah, I think, as you said, right, acknowledging what one organization can do and what others can do, it's important, partnering. So acknowledging those efforts that are already happening, and then summing efforts and amplifying those efforts is important. So coming and saying like, well, now I'm going to do everything, right? So I think that's what we've tried to do with the Latin American Collaborative, sort of partnering with organizations in the different countries and expanding what they are doing. We're also doing activities, but they are complementary to what they do. So having that respect for the work that they've been doing over the years is really important, and creating that trust relationship.
Okay, awesome. And I definitely want to leave time for questions. I see people's hands already up. around the room because they're so excited. So we definitely, we definitely want to leave time for questions. But with that being said, before we finish our session, I'm gonna round it out by asking this question. So if you can think about all of the things that we talked about and really think about the overarching conversation about best practices for engaging community members, what would you leave our audience members with who've come here to wanting to really learn some real health equity tools? What would you leave them with? And I will start with Siwaar.
Yeah, I would say the big takeaway, at least for me from our conversation, is communication and collaboration, and really knowing, how you can serve as a bridge and how your organization can serve as a bridge for these families that either, know the diagnosis already, are still, not completely diagnosed yet, wherever they are on their odyssey, making sure that you provide those resources to bridge them to the resources that they need. And also language, and it's not only types of languages, but it's also the types of words that you use. So is a family at a certain point where they want to use the word condition or disease? Maybe they're not comfortable using those words. So making sure that you have reflexivity and really know where you are in the context of that conversation to make sure that you're meeting the family's needs in that present moment.
Awesome. Claudia?
Yeah, I think transparency and clarity in sort of what that relationship is. When you are engaging directly with patients, if you're including them in research, sort of going back to your first question, right? Like, what can they expect? What are the timelines? Making sure they understand that many times we won't necessarily find an answer, so that to keep realistic expectations. And then also to Siwaar's point, when you're partnering with organizations and with patients, be culturally sensitive and have that respect for whatever they think about how rare diseases are, how the culture context it's important.
Okay, awesome. Thank you. Cecile?
Yes, I agree so much with Claudia. Being sincere, you have to be sincere and cultural sensitive, because you have people that have these diseases, but when you come in contact with them, if you go to their homes, you have to be very careful of, the different things that they do within their home. So I want to say that please be sincere, have sympathy, and then too, look at yourself like, this could be me, or think about how would you feel if someone come into your personal space, or if someone come into your house, how you would want someone to treat you if you were the patient. Think of yourself as being on the other side of or being in their shoes, and how you would want someone to treat you. So having some sympathy, even empathy, but most definitely being sincere, and just let them know that you really do care, because they can tell.
Okay, and I'll leave us with this, and I say this all the time, so if you've seen me before, I'm sure you're like, Tanisha, you've said this 60 times, and that's okay. I think that we have been trained as like machines. Think of it as machines to churn out different types of work and everything that we do. We're trained to meet these deadlines. We're trained. So to a certain extent, we're trying to do all of that, and we forget the human side of what we're doing. I always give this as an example to my students. Like, hey, if you're walking down the street, right, and if some random person just walks up to you and says, hey, Tanisha, give me your information. I mean, that's gonna be like, hey, no, I don't even know you, right? I'm not giving you my information. That's not normal. So why do we think as a community that we can go up to people and demand things from them without even meeting them where they are, without finding out who they are, without understanding, hey, what is happening in your world? Like, hey, what is your everyday life circumstances? So I challenge us to think about that. If somebody walks up to you on the street Because that's what many of us do. We come to a building and we say, hey, I need you to fill out these surveys. It's the same thing in practice. So let's think about that. And sometimes it really doesn't. It does take to Cecile's point, hi, what's your name? A quick conversation before you ask somebody for something. So I challenge us to think about that and to really rethink how we've been trained in many situations to treat people as humans. And we want to be treated as humans, and to take that into the work that we do every single day. I think we're perfectly on time, and so I'm going to open us up for questions. I'm not sure, Pam, if we have online questions or not, but I'm going to let you take it over.
Not yet.
Okay, thank you, by the way.
But we have questions in the room. Oh, sorry.
Do you have ideas on how to gain trust when there's a language barrier, specifically, say, when you're using an interpreter, and even more difficult, say, when you're doing that over the phone? Thank you.
I'm happy to start us off if that's okay.
Yeah.
Yeah, that's a great question. I would say having people from the community is so important, because not only will you have that language barrier kind of torn down, but there's also context. So for one example, in the Project Mina pedigree campaign that I talked about, we had Arabic translation, and so that went great. We translated all materials. And then when I was speaking to families, I'm an Arabic speaker myself, I noticed quite quickly that the word we have for genetic also means hereditary. And so when I was speaking to families, there was kind of some misinformation, just because even though we're translating the word itself, genetic, the meaning wasn't carrying over. And so some families, felt that it wasn't representing what they were going through. There was also cultural taboos that were kind of touched on because of that misinformation. And so I think it's important to have your materials translated, but also people from the community to kind of put it into context. And so we started using other words to kind of try to explain the message we were trying to relay to avoid that conflation. So that's one lesson that I learned.
Awesome. Anybody else wanted to say anything to that question?
Yeah, I think definitely translating materials and putting them in the language that the person, the patient, the family feels most comfortable with is really important. One thing that we've been facing is in what we do in Mexico is that sometimes we have families that don't speak Spanish, so they have a native language and they might not even read. So we are also considering how to make materials in a more graphic way so that they don't need to be read, and then we can have that message conveyed and explain to them sort of what we want to do without necessarily having the person to read. So it's trying to meet the person, right, as it has been said, sort of where they are and what they need to understand what you are trying to communicate is important.
Thank you.
Good morning. Thank you all for what you do. Truly appreciate it. My name is Derek Campbell, and I live with Fabry's disease. And you know what will help me when you guys talk about research and data collection? I've never met a person who did research and data collection who had Fabry disease. And if somebody was to knock on my door and come in to collect research and data, and the first thing they said that they had Fabry disease, I will feel more welcome and feel more enlightened to give out more information. Relatability, familiarity, all those great things, right? So my question is, do you guys work closely with patients of the rare disease that you guys are doing research on to get that familiarity and that comfortability with the community?
Good question.
Well, we actually try to work with everyone. I don't have any rare disease, but one thing I do know is I know hurt people. I know people who really need someone to listen to them. And when you are sympathetic and you have empathy, I mean, even though you don't understand or you don't, you can't relate, but you can listen. Like, you really can listen, because most times, people they want to be heard, and they want you to listen to them. They want you to understand what they're saying. And we really try to get help for everybody we come in contact with. You know, all in rare, we still pretty much at the somewhat at the ground level. So anybody that we can get that need any type of any of our assistance, no matter what their disease are, we're gonna help them. But first, you have to be sincere. Like, you have to know that you really want to. Because when you see me, I'm not coming in for your vitals. I'm not coming in for your medical report. I'm not coming in for anything. I'm coming in asking you, what can I do for you?
Anybody else want to answer?
Yeah, same thing. So we work with patient organizations, sometimes with patients themselves, and again, just trying to learn from them what their needs are and how we can help. Sometimes we can help with referring them to physicians or a geneticist if they haven't had genetics referral, or we try to help with access to testing. So yeah, I had a patient recently that she's 35 and she has some muscular dystrophy. And I was asking her, so tell me about how you grew up. And she's like, no one has ever asked me in my whole life about like how has my disease progressed, how I feel, what challenges I face. So I think listening is definitely very important, and learning from the patients and the organizations that have those boots on the ground.
And I'll add this, Pam, before we go to the next question. I think that's very important. And I think some of that, sometimes you may be dealing with a rare disease that you may not know other individuals out there with that specific rare disease, but I think this is a learning moment and can be a learning moment for your staff and your team. So what we try to do, I know Global Genes as an organization, we have a number of individuals with rare diseases on our team, so they can provide a different perspective for us. So we're always kind of on that grounded level of, okay, what does that look like for someone that is living in that experience? I also think that's where Siwaar talked about this in our panel, where when you start engaging with individuals, so for example, let's say we partnered on a project, I would ask you, like, what are partners that we can engage with to get at exactly what you're talking about? Because I may not be familiar with them, but I also have to be transparent about my lack of knowledge in that area and lead you. You're the expert with that. Hey, do you know anyone? And it's not just your responsibility. It's also some responsibility on my end to do some due diligence to find out what that looks like in the space that we're in. I also think there are numerous ways to do that and embed that not only in your organization, but also with your project. So, I mean, I always have to give a plug for All in Rare because it's a program I lead, but we try to do that by making sure, like our community advisory board has numerous individuals that may have a child with a rare disease. They may be affiliated with a congregation. They also may have a rare disease. We have a steering committee. It's the same way. So making sure that everything that we do, we have rare disease that's a part of that. And if we're missing a component, we then can work with our partners to say, hey, we're lacking in that area. Can you help us? And we can identify more individuals. One example of that is we had some issues where we needed to translate, and we didn't have a community health worker that spoke fluent Spanish. So we had to go out and we had to find that, and we're hoping to do that for different communities as we continue that program in the future. But I hope that answered some of the question of how we can be better. Pam, we're ready.
More questions?
Hi, I'm Danny Baisden, and my daughter has an ultra rare disease. She's the only one on record at the moment with her variant. So but there's possible suggestions that there may be other people who have this disease, but they're spread out all over the world. And so do you have any suggestions on how to kind of approach those different communities and locate them? Well, just when we do locate them, how do we make sure that we're connecting across several different cultures, especially when they're most likely isolated even in the disease community, because we are so ultra rare?
Patty?
Well, I think the major issue that we have with other parts of the world is that there's very little access to genetic testing. So that's something that we're working on improving, but many countries in Africa, Southeast Asia, Latin America, definitely, the access to genetic testing, to genomic sequencing, it's very expensive, it's not covered by insurance or by the public healthcare system. So I'm very sure that there will be probably many other patients with the condition of your daughter, but the problem is they don't have a diagnosis yet. So it is harder, as many of you know, right, to find a community if you don't even know what disease you have, and share those same challenges that you have with that condition with others if you don't find that community yet. So that's something in terms of equity that it's very important to address, that, as mentioned before, every patient that needs genetic testing can get it no matter where they are, what their socioeconomic status is, or which country they were born in.
I completely agree. I think access issues really prevent populations worldwide to get the resources they need genetically to get that diagnosis. Also, just qualitatively, I haven't seen this through my work specifically, just because we only work in the US, but just personal observations, I've seen a lot of patients tend to be looped into big buckets. So the epilepsy bucket or the delay bucket or the dystrophy bucket, and kind of stops there where there isn't kind of further genetic testing. So I wonder, if we can reach a day where hopefully we get resources to these patients so that they can get more specific diagnoses and not just looped into these larger buckets.
This will be our last question.
Hi, my name's Kevin Friard. I'm from Salem Oath Consulting. I'm working with a group of people who work in clinical operations, trying to improve the representation in clinical trials. And one of the things we've looked at is reaching out to communities and trying to teach the companies that are doing these, or the organizations that are doing the clinical trials, you can't just do a one size fits all. You got to do a one size fits each. And so what we've heard here this morning is you need to do enough work to gain the trust and understand what the community needs, that you can give back to them, how you can have a partnership. We've heard ultra rare. Dr. Wright talked about the fact that you're not even getting included in the diagnostics. My question for you is, how do you know when you've done enough community trust building? How do you assess that and then say, okay, now I can start taking the actions that were written in my grant?
Oh, good question. Anybody want to? You can answer. Anybody want to answer?
I can start, and maybe we can piggyback off of
I'm
things.
happy. Yeah.
But I think something that I've noticed for a really successful collaboration and trust building is having that trust before you even apply for the grant. So having the plan in place so that when the grant starts, that's not when the communication starts, but there's a solid foundation, and the grant is just kind of the start point of the project. And so I'm a really big advocate of getting out there, knowing the community, collaborating on events, maybe doing something they need. Maybe they need a geneticist to go talk to their community and kind of fulfilling their needs, and then asking for something in return, I think has been successful in the past. So I think that can partially answer the question. And then maybe this is like kind of a big answer, but I think there can never be enough trust building or enough community building. And I think it's definitely an ongoing process and not necessarily something that has an endpoint, but a continuous discussion. So
I see why you said everything that I was going to say. So I'm going to try to be answered differently. I think the key to that, first off, is making sure that the clinical team has a good education component. I was speaking with someone when COVID had just started. This was a very, again, very educated individual. She was participating in her first clinical trial. She was like, hey, Tanisha, I really need to take you to the side. I have a question because they're trying to do some weird stuff to me in this clinical trial. And I was like, my background is research, so I'm like, I doubt it, but tell me more. I didn't say that to her. But I'm listening to her, and I recognize that what was happening, she was probably in a placebo group, right? She didn't know it. She's not supposed to know it. She's blinded to it. And now that they've realized that this is efficacious, that now she's moving to receiving her actual dose of whatever that immunization was. But she tried to reach out to the clinical education person, and she was like, oh no, I can't give you any more information about that. I can't do that. You're not supposed to know any of that. So for her, it was like, no, you have been sticking me with a needle for over the last, 6 months, and I'm not gonna allow you. You told me that I'm only supposed to get 3. Now you're gonna do it again 3 more times? But that is so important. So that clinical educator needed to, at that point, yes, there's information that you cannot tell, right? But there has to be a better way of communicating that to someone. So I had to sit her down and say, hey, of course, I'm not gonna mess up the trial, but really have this conversation. Well, what I think is happening right now is now that they've realized that this immunization is effective, this is what's happening. And explaining that to her, she was about to drop out of the trial because of communication that she had with somebody on staff that was not effective. So I think that is a first step. The team has to be collaborative, and it has to be representative, and it needs to have people that are academic, but also people that can have a conversation with someone without talking about you're in a blinded clinical trial, right? So I think that's a part of that, and I think Siwaar is head on. Community engagement never stops. There is no metric. I do think that as you're going through that, you realize that there is some authenticity that's built, and you will recognize, okay, this is our tipping point. But we can talk about that more. I can talk about that all day. I love that.
The question wasn't about when you stop community.
Yeah.
It's when you start the work that you intended to do.
Yeah, you
When you feel comfortable enough to go, okay, now let me tell you about this study that I did.
Yeah. And I think that is a cycle. And I think there is a turning point where you get to, where you realize, and you can ask people, hey, okay, is it time? When is the best time to start asking for that information? And I think that can be a conversation.
Thank you so much,
Thank you,
panel.
Pam. Thank
So many
you.
important insights, and it was a great discussion. I know we could go on a long time, and we're sorry to see you go, but let's give them a hand for
Thank you,
all their
Pam. Thank you,
contributions.
ladies.